Hi, my name is Mark Milligan. I'm a physical therapist here in Austin, Texas, and I'm also the founder of Revolution Human Health. It's a nonprofit physical therapy network that delivers access to care for people who can't afford, who don't have access to physical therapy and movement-based therapy here in Austin, Texas. I would love the opportunity to address and speak to the people that come to and are a part of South by Southwest on a much larger issue of health in this country. We're dying earlier than we ever have before in this country. The generation being born today will have a shorter life than any other generation born in the modern era of this country. I propose, and I would like to propose to people simple solutions to that. Really looking at for the biggest systems of our body and for the biggest killers of us in the United States, and really addressing what those numbers look like, but also on the flip side, how we can change the impact of those disease processes, those killers of our society, and how we can change that and make a difference in individuals' lives. I think that really when we talk about healthcare, it's not really healthcare. What we have in this country is sick care. What I'm proposing is that we switch and flip the model where patients have and people have the power and the information to take charge of their health. And that is the beauty of this talk, is really taking things that impact everyone's lives: diabetes, high blood pressure, cognitive or depression, cancer, things that really have a large impact in each of our lives, really, and how we can modify and what we can do ourselves and have patients and people do to modify those risks in their life. And it's extremely simple. And I think that the the biggest issue is that there's a lack of information, there's misinformation, and there's also a perception that change that is needed to prevent or to to change an outcome of a disease process is difficult when it really isn't. The data is quite simple, and I think that this talk would enable me the ability to distill current information, current best evidence, current data and current numbers from this country, and distill it down to an individual level that can help people be motivated and help them change their outlook about what their health could be or what their health is and how it could be changed to be something better. And put it in real life perspective. Really, it's about adding quality of years of life on the end of our life and in the middle. And if we can do that, if we can add quality life, quality years, that is where the magic happens, is to prevent people from going down a path where their cost and their health care exponentially rises because they don't address things early enough in their life. Having the opportunity to do that through this platform would be a tremendous opportunity for me and for, I think, the people of this country, because this is where we have to fundamentally change, is with our own accountability of our health and how we look at ourselves and how we treat ourselves and our body. Um, and, uh, and I would appreciate the opportunity. Thank you. And if you have any questions, please reach out. Thank you.